homepage, we're back. Kasama ko ngayon si Dr. Juan Moore Jr., American Chiropractor of the Philippines, upang talakayin ang tinatawag na Chiropractic Therapy. At ito ang mabuting maidudulot nito sa ating, ano pa mga mabubuting idudulot nito sa ating kalusugan. Ayan.
At syempre, good morning, Dr. Moore, and welcome to
Nice
homepage.
to have you with us.
Thank
And
you.
with us this morning, as well as Mr. Paul Habok. He
Yes.
is a general physical therapist. Good morning and welcome to homepage.
Yeah, good morning, guys.
Alright, and kasama
okay.
din natin sa ating studio si Miss Baby Biton.
Yes.
Naging pasyente siya ni Dr. Moore.
Dr.
Meron
Moore.
siyang kondisyon na tinatawag na
Spondylolisthesis.
ayun.
Ano po yung
Maraming
condition
salamat
na
sa
yun? What is
pagtulong.
spondylolisthesis?
Yes.
Okay. Ito pong kaso na to ay pwedeng genetics or degenerative. Yung pag nag-old age tayo, nagkakaroon na ng depekto dito sa tinatawag nating pars articularis dito po sa area na to.
Yes.
Is either na-fracture siya or kusang lumalambot, then itong mga vertebrae natin dito tsaka disc, nag-forward po yan.
Ay,
So,
nakaprotrude.
nakaprotrude.
Before we
Papuntang
actually
unahan.
drill down on this medical condition, pag-usapan muna natin, hindi kasi alam ng ating
Yes.
mga taga-subaybay. Not everybody knows what chiropractic therapy
Yes.
is all about. Dr. Moore, maybe you could explain to our viewers this morning, what is chiropractic therapy?
All right, well, basically what chiropractic is we realign the spine. The best way I could describe this really simplistically is it's like hitting the reset button. Over the years, you've developed spasms, muscular pains, you know, issues with your neck and your low back from either sitting in the
True.
long car ride
So
or,
true.
Yes.
you know, or sitting in front of the computer. So basically what my job is to evaluate the spine, evaluate your posture, and then basically reset things to zero. You know,
Okay.
realign things that maybe you didn't even realize were out
You
of
had a
place.
problem. Yeah,
Yeah.
okay.
But Dr. Moore, you used to be a wrestler, right?
Trivia
Just
for
getting into the
viewers,
history
he
of
used
Dr.
to be
He
a
used to be a wrestler. How did you get into chiropractic?
Well,
Or chiropractic practice?
Therapy.
Yes, therapy.
I was in grad school, and you know, it just basically happened. Like I always wanted to wrestle. I was wrestling since I was a kid. I was interested in it since I was 5. When I went into undergrad, I met some people who knew how to get involved with it. And then ever since I was in college, I started wrestling. But then when I got into chiropractic school, I kind of combined the two.
Yeah.
So then it gave me an opportunity when
The
people
injuries
found
you
out.
got from wrestling that you could actually treat
Well, actually,
through chiropractic therapy.
it was.
Is that how it works?
Well, no. Once people found out that I was legitimately a board licensed certified chiropractor, when I was at shows, guys both in the locker room and people in the crowd would start asking me different questions on if, you know, what I do could help them with their particular problem.
So they
So-
didn't get scared of you?
No.
No? Okay.
When we say degenerative, it means that as you age, as you
Yes.
get older, so the cells get weaker, and then the spine
Yeah.
gets weaker as well.
But-
They say that calcium has a lot to do with this as well. Would you, as a chiropractor, would you suggest that women, especially women who are more prone to getting osteoporosis, should be taking calcium supplement in the earlier years? Is that
Well,
as
you know,
what they're saying?
if anything, I would highly recommend it in early onset, like an early age. Everyone should be taking a very beneficial multivitamin. And there are different multivitamins on the market that, you know, are better than others.
Yes.
It's up to you and your doctor to decide which one's the best.
Okay.
But, you know, you don't want to necessarily just take one particular supplement unless your doctor recommends you to. And normally you wouldn't just take calcium, you would also take vitamin D along with it,
Yes.
and magnesium.
Oh.
But what about women who have
History already.
osteoporosis? Yes, can they go on under chiropractic
Absolutely.
therapy? Yes,
You know,
they
you
can?
just have to be careful. I've adjusted patients from 3 years old all the way up to 100.
Okay.
All right, so 3-year-old kids all the way up to 100-year-old women. And, you know, you have to just be careful. You have to be vigilant with your diagnosis. You have to, you know, basically ask all the questions. Paul knows, you know, you just have to
know
make
what
sure
you're
that
doing,
you
yeah.
take the proper precautions with each patient.
Okay.
Okay.
And in a particular session, we just want to get a glimpse of how a chiropractic session or therapy
Yes.
would be like. What are the certain kinds of manipulations do you do? Are there things that you inject? I don't know, does it hurt?
No.
How is a typical chiropractic therapy like? Maybe we could demonstrate,
Yes,
sir,
with, Miss
with the
Baby
help of
Biton.
Mr. Paul also, and of course, Dr. Moore,
Yes.
on Miss Baby, na
Yes.
nagkaroon siya ng kondisyon na tinatawag na
Spondylolisthesis.
Ayaw sabihin.
That's me.
and that's
Yun po
you.
yung
So maybe, sir, we can
naka-protrude.
ask you to
Yeah.
go
Yung
near...
Naka-forward yung vertebra or kaya yung disc. So,
Yes.
yung area natin dito, meron mga nerves and spinal cord. So, naiipit yon,
Aha.
causing yung mga radiating pain dito. Which na meron po si Miss Beaton. Yeah.
Okay.
She has
Okay.
it.
Ma'am, is she wearing a lapel?
Ay, wala.
No, okay,
No,
let's
no.
borrow.
Okay.
Gusto nating malaman mula kay Ma'am Baby, ano po yung mga
Nararamdaman
nararamdaman nyo,
ninyo
sintomas
noon.
nung kondisyon na?
Before you were
Spondylolisthesis.
Yes.
Ayun.
Nagpa-x-ray ako and the result was that I had an anomaly in my spine. So L4, L5, naka-protrude yung L4.
Okay.
So according to the doctor, we have doctor and ortho doctor, naiipit daw yung aking mga nerves. So ang nararamdaman kong pain ay nasa likod ng hita na nagraradiate hanggang sa aking legs.
Mhm.
So it came to a point na talagang hindi na ako makalakad. Sa office, parang minsan dalawang lalaki ang aalalayan ako
Nako.
before I can walk.
Pero
But
ngayon,
I have undergone 10 sessions of PT.
yes.
So it came to a point na talagang hindi na umubra.
Okay.
So I had a clipping of Doc Moore's
Chiropractic.
clinic.
Yes.
Yeah.
And practice.
I told my husband, samahan mo ko dito, dalhin mo ako dito kasi no amount na nung aking PT
Mhm.
ay makapagbigay sa akin ng
Cure, ng relief.
ginhawa.
Mhm.
No amount of medicine.
Mhm.
Yeah, I have
Mga
taken
painkillers.
painkillers.
Yes.
Pero hindi magka-effect sa akin.
Okay.
Talagang gusto ko na lang nakahiga.
Wow.
So, pumunta ako sa kanila. First meeting, absent si Doc.
Okay.
So, Paul gave me PT.
Okay.
So, kinabukasan, nag-meet na kami ni Doc Moore. So, I gave him my x-ray. And yun nga yung in-explain kanina.
How many sessions have you undergone?
I have undergone 3 sessions with him.
Trina, and si Ma'am
Trina.
tumatalon pa papunta dito. She was
How soon
jumping
did
to
you
get here.
feel relief?
Ah,
Baka gusto natin
Gusto natin i-demo.
i-demonstrate.
Mr.
Yes.
Paul, maybe you
Maybe
could-
we can, yes.
Oo.
Let me have this.
and then we
Okay.
could hold the
Sige.
mic for
Are you
them,
ready?
Ate
Are you
Alma.
doing the?
No, just
Okay.
Okay?
Okay, ma'am, you need... Ayan. Oh, kayang-kaya niyo ba?
Ayan.
Mataas tong bed,
Ay,
ha?
nung una, hindi ako makakilos ng ako lang.
Opo.
Kailangan
Could you hold it
tulungan
for me?
ako.
Oh, sure, sure.
Going on my side,
I'm on-
tapos going down, talagang hirap na hirap ako.
We
So
need to...
ngayon, ganyan na.
We need to ask Dr. Moore, what kinds of bone diseases or medical conditions
Nalunod ako.
could actually be treated or cured through chiropractic therapy?
Well,
Because not all kinds of
Yeah.
bone disorders,
Yes,
diba?
yes.
So which ones in particular?
Well, it wouldn't really affect bone diseases. Like bone diseases are degenerative things that are like an aggressive. Like I can't prevent osteoporosis. I
Yes.
can't stop disc degeneration. But what we can do is realign things and get you feeling more comfortable and feeling better. What we do, giving you a healthier lifestyle.
Okay.
All right. So basically, like me being able to keep the body in motion. You know, ever hear that statement, a body in motion stays
Yeah.
in motion? Well, it's the same with the segments of your spine. It's the same with the joints in your body.
Yeah.
You have to keep motion in those joints.
All right.
All right. So when you have adhesive tissue, when you have problems where areas in the body kind of get stuck, that can lead to degeneration.
Okay.
Now, if I get in and we wind up manipulating the areas
Yeah.
and we mobilize things, it keeps from things degenerating.
All right.
You understand what I'm saying? So
Okay.
it's like I can't reverse the sands of time.
Of course, because if you can, then everybody will go to you. But at
Okay.
least you relieve them. of the conditions that they'll have to go
Yeah.
through because of this degenerative process.
Yeah, as
right?
long as we
like
keep
now
you.
she could walk.
Yeah.
I mean, compared to
fine.
before.
Yeah.
Okay, so
As,
let's start
here
as
now
long as
is
we keep you
Dr.
healthy
Habak.
Yes.
and moving and
The
mobile.
ligaments could actually move correctly.
Absolutely.
Okay.
All right, so let's
Oh,
start.
Ayan si Dr. Habak.
So maybe, Mr.
Maybe you could
Habok,
tell
while
us-
we're doing it, no,
Oo.
maybe you could explain kung ano pong ginagawa natin.
Okay, so eto, since si Mami has a pain,
Mhm.
lalagay natin to. This is what we call the TENS or transcutaneous electrical nerve stimulation.
Mhm.
Indication of this one is for pain relief, no? Yeah, it's like ano lang siya, micro massage sa area.
Wow.
Okay.
Ang purpose niya is to increase the blood flow sa area.
Okay.
Is that
Therefore,
painful?
It
Masakit?
is not, it's not.
Parang kuryente?
Yeah.
May kuryente?
Para lang yung nagkakaroon o nakaka-feel ka ng
Okay.
insect crawling on the skin.
Ah,
Okay.
insect
So
crawling.
intramuscle ba yan?
Yeah.
But
You
not
could say
an
that
ant
it's
biting the
intramuscle.
skin.
Superficial lang siya.
Okay, that's
Ah,
different.
okay.
That's
Okay.
gonna hurt.
So, dito ilalagay natin siya sa area na painful.
Yes. So this is your part. Ito yung sa physical
Ito yung physical
therapist.
therapy part eh.
Okay.
So, bali for pain relief.
Okay.
And then we have to soften the area later on with the use ng ultrasound natin.
Ah, may ultrasound pa. Okay.
Okay.
Kasi sa clinic, we have a machine, the big one.
Mhm.
You can use combination of electrodes and this one. This is also an ultrasound for softening of the tissue, yung
Okay.
muscle. Kasi if you have pain here, magkakaroon ka ng tinatawag natin tightness, spasm.
Ah, okay.
I'm sorry, is this the same ultrasound that is being used by the dermatologists for tightening of the skin?
They have different frequency.
It looks like that.
Sa beauty,
Diba?
parang
For
ganyan niya.
tightening Ate Alma, diba?
Yes, yes.
For cellulites.
For cellulites, correct.
Kasi yung light yata is bigger.
It's a high frequency yun.
A high
Ah,
frequency.
okay. So
But
this
it's not
one is
like
low
that.
lang.
Okay.
Pwede mo siyang pwede mo siyang i-adjust into high and low frequency.
Ah, okay.
Oh.
Okay, so let's do it. All right. Okay.
So, Mami, tell me if you feel something, okay?
Okay.
Walang pain to.
So kayo muna pala, physical
Yeah.
therapist muna
Yeah.
ang magsa-start. Okay.
Actually, when I put this one, this is accompanied with a hot pack or a cold pack. It depends sa severity. For example, si Mami matagal lang may back pain, so that's chronic already.
Yeah.
I wanna
Okay.
put like a hot pack.
Ah, so
Pag may
that's when you use hot pack pag
Yeah.
chronic na yung sakit.
matagal na yung pain nila. Minsan kasi, may mga
Okay.
pasyenteng pupunta, acute siya, kakapilay pa lang, you have to put ice.
Mhm.
Okay.
Okay.
Okay, Tita, you feel something? Tell me.
Okay.
That's enough?
More.
More.
More?
More.
So she's kind of
Okay.
immune to it already. The
Yeah.
threshold is
That's good enough,
Higher.
Mami?
Yeah.
Okay. Ang kagandahan pa nito, no? Yung brains natin nagsisikret ng tinatawag na endorphins, no?
Oh.
Yes.
That is a natural painkiller. So,
Mhm.
if, kahit huwag ka na mag-take ng
feel good
medication.
din yan, diba? So
Uh-huh.
she feels better and
Afterwards,
after
yeah.
it.
Alright.
Okay.
Mami,
Okay.
I'm gonna do the other one, huh?
Okay.
How about this one?
Also, the use of this actually makes my
Yeah.
job easier because we're
Fine.
soothing the muscles, relaxing the muscles that are spasming.
Yeah.
So now, once she's in a relaxed state, I'm able to get in there and hit the
Manipulate.
joints the way I
Alright.
need to.
So, Dr. Moore, what we're saying here is a typical chiropractic therapy would involve such equipment, which Mr. Habok has shown our viewers, and manipulation.
Yes.
Maybe we could just see, sir, and to interrupt you, I'm sorry, just
Okay.
for the viewers to see a little bit of manipulative moves. Or
Mommy, how are you
chiropractic
feeling?
Moves.
Uh,
How does-
fine.
You okay?
Masarap.
Masarap.
Okay.
Try it there, done. On the neck
Yeah.
or what?
I'll do
On
that.
the neck? Pwede
How's
ba sa
it?
neck?
What's
Is it
hurting
not
right now?
dangerous to
What's
touch
hurting
the
me?
neck?
No,
They said it's
no, no.
dangerous to touch-
No,
I
I mean,
think
if
my
you don't
neck
know
is
what you're
hurting
doing, then yeah. But I mean,
Okay.
you know, if
So
if
there's
you
a way
know,
of doing it.
yeah. The biggest misconception
Yes.
I've heard since I've been here is I'm afraid he's gonna rip my neck, and it's not a. I barely rotate your neck, and I'll show you.
All
I'll
right.
show you what I
Okay.
do.
Okay,
But
okay, we want to see
Alright.
that. All right.
can you just put your arms out to the side? No, no.
The position
no,
of
no,
the
no, stay
patient
with-
is
stay-
also very important,
Face
right?
down. Face down.
down.
Yeah,
Okay.
Ayan.
just like that.
So
Okay,
what he's doing now, Ate Alma, is he's manipulating the
Yes.
neck.
Yeah, he's manipulating the
Okay.
basically I'm feeling for
paramusculars.
areas that are.
So what is that
Okay.
part,
So
Dr.
you
Tense
can-
Moore?
muscles.
You can feel right here where my thumb is.
Oh, yeah.
You feel how the muscle's tight
Oh,
right
yeah,
there?
yeah, yeah, it's tight.
Okay. So now,
So it's
what?
not really the neck. It's like a below the neck,
Yeah,
right?
it's right in the shoulder area.
Right here. Okay.
I think this, oh yeah, mine is tight too.
Uh-huh.
Yeah.
Doctor, maybe we should have another session later.
Okay, so basically all I do, now everybody thinks that you're gonna take the person's head and
That's not true.
do all this. And
That's a
I'm not,
misconception.
I'm not doing that. All I'm doing
okay.
is I'm here,
Okay.
and now look, just like that.
Press on
You
the head
will
a
hear a
little bit.
popping sound.
See how
Oh,
little
was that the pop
the
sound?
motion is?
Oh, I heard that.
See how light that
Anong
was?
feeling, ma'am? Ano parang...
Ang sarap!
Did you hear the popping
Ang
sound?
sarap
Okay.
daw.
All right.
Na-relax na siya.
Okay.
See how light it is? Like
Alright.
basically, like if something is out of place, it wants to go back where it's supposed to be.
Correct,
I don't
okay.
need to pound on the
Yes.
person's body. Even when I come down the spine, how's that feel right there?
All right.
Okay. All I do is contact here.
Oh, I heard that. Did you
Huh?
hear that?
Wow!
You see how
Okay.
light that is?
Well, itutuloy po namin mga ka-homepage
Yes.
ang therapy na ito kay Ma'am Baby. At kami rin po ni Ate Alma,
Oo.
Dr. Moore, okay? We're next. We are your next patient. Sa pagbabalik po ng homepage, marami po tayong pag-uusapan. Magpapasalamat muna tayo, Dr. Moore. Thank you
Yes,
so much.
thank
Thank
you
you.
so much.
Thank you.
Okay, thank
Mr.
you so
Havoc,
much.
thank you